Zang, The Organ System of Traditional Chinese Medicine by Jeremy Ross, page 246, chapter 18, Case Histories. 8. Arthritis and Stress. A woman of 70 had pain in the joints of the hands, shoulders, neck, lower spine, hips, and knees. This pain was of fixed location, aggravated by cold and alleviated by warmth. She also had indigestion, nausea, bitter taste, and periodic pain in the epigastric and in the right hypochondriac region. She suffered from irritability, hypersensitivity, headache, dizziness, insomnia, and periodic eczema. These symptoms were aggravated by emotional stress, which was continual with periodic severe crises. She had a dull, pale face, pale lips, felt weakness and lack of energy, and had the early stages of the cataracts. Her pulse was empty, thin, choppy, and wiry, and her tongue was pale and flabby. Diagnosis. This case, with its complexity, chronic deficiency, and stress, is typical of many in the West. In fact, the case was considerably more complex than outlined here, where only the essentials are dealt with for the sake of simplicity. The pattern was one of chronic internal deficiency, with periodic exacerbations due to stress, and both Zhangfu and Zhenluo were involved. The dull pale face, pale lips and tongue, thin choppy pulse, and weakness suggest deficient Xue. The dizziness and insomnia may be due to deficient Xue or to deficient Yin and hyperactive Yang. The lack of energy, emptiness of the pulse, and a flabby tongue suggest deficient Qi, in addition to deficient Xue. Also, in TCM, optic degeneration may be due to insufficient Qi and Xue to nourish the eyes. Deficient Yin and hyperactive Yang of Gan resulted in the irritability, hypersensitivity, headache, dizziness, insomnia, and thin wiry pulse. Depression of Ganqi was associated here with depression of emotion, depression of the flow of bile, hence the bitter taste and hypochondriac pain, and invasion of Qi and Wei, leading to indigestion, nausea, and epigastric pain. Chronic eczema in TCM may be due to heat lodging in Xue in cases of deficient Xue, but here, the fact that the eczema only occurred in periods of severe emotional crisis suggested that the heat in Xue might also be associated with patterns of damp heat in Gan and Dan, and fire in Gan. Deficiency and imbalance of Gan would also tend to affect the eyes. The pain in the joints, which was of fixed location, aggravated by cold and alleviated by warmth, corresponds to the pattern of fixed B in TCM. This patient had done much heavy manual labor in the past, with considerable wear and tear on the joints, producing foci of bone deterioration and weakness of circulation of qi and xue, which with the age and deficiency of qi and xue became worse, causing pain. Treatment. There are four main areas of treatment: deficient qi and xue, Gan disharmonies, fixed B, eye disorders. With this patient, there were too many disorders to treat them all in any one session. Too many needles would be required, and this patient, due to weakness and stress, would be likely to faint. Therefore, it was necessary to produce a long-term plan of treatment. However, the results of emotional crisis had to be treated when they occurred, causing temporary departure from the planned treatment schedule. Deficient Qi and Xue. Points were selected from such as the following and used with reinforcing method. Caution was needed with the use of moxa, especially on points connecting with the yin organs, since this patient tended to yin deficiency, especially in times of emotional crisis. Qi Hai Renmai 6 to strengthen qi and circulation of qi. Zhu Sanli, stomach 36 to strengthen qi and shui and their circulation. Shui Hai, spleen 10, regulates circulation of yin qi and shui. Also clears heat from shui as in eczema. San Nin Jiao, spleen 6, strengthens function of qi and wei to form qi and shui, strengthens circulation of qi and shui, clears heat from shui as in eczema. Gongsun, spleen 4, strengthens pi, wei, and chongmai, relieves pain, especially in epigastric region. Yishu, bladder 20, strengthens pi and shui. Yeshu, bladder 17, invigorates circulation of shui. Xinshu, bladder 15, invigorates circulation of qi and shui. Gan disharmonies. Points such as the following would be used with even method. Taizhong, liver 3, regulates Gan to relieve depression of qi and pacify hyperactive yang. Yanling Guang, gallbladder 34, relieves damp heat in Gan and Dan, pacifies hyperactive yang. Fenqi, gallbladder 20, pacifies yang and clears the mind to strengthen the eyes. Baifui, Dumai 20, to pacify yang and calm the mind. Intang, MHN3, to clear and calm the mind, to relieve tension and headache, dizziness and insomnia. Fixed B. Points such as the dose below were used with reinforcing method and with moxa. Hans, Sanjian, large intestine 3, Hegu, large intestine 4, Yangshi, large intestine 5. Shoulders, Binao, large intestine 14, Jiangyu, large intestine 15, Jugu, large intestine 16, Jianneiling, MUE 48. Neck, Dachui, Dumai 14, Chuanxi, special points. Lower spine, Yaoyangguang, Dumai 3, Guanyuanshu, bladder 26, Baliao, bladder 31 to 34, Shiqi Shuixia, and BW 25. Hips, Huanxiao, gallbladder 30, Yanlingguang, gallbladder 34, Juegu, gallbladder 39. Knees, Xiyang, stomach 35, Xixia, MLE 15, Heating, MLE 27. In addition to Zhu Sanli, Xue Hai, Yinling Guang, and Yangling Guang. Eye disorders. For the initial stages of cataract and the generally weak vision, points from the following list would be used with gentle insertion and minimal manipulation. In addition to Taichung, Yangling Guang, Intan, and Fenqi, the following points might be added. Guangming, gallbladder 37, Tongqi Liao, gallbladder 1, Zanchu, bladder 2, through to Jinming. Jinming, bladder 1, Chenqi, stomach 1, Yiming, MHN 13, Jiuhou, MHN 8, Tou Guangming, MHN 5, and Yuyao, MHN 6. Patient education. This patient needed rest, relaxation, and quiet, and specifically needed to avoid heavy work, lifting, or exposure to cold. That would tend to aggravate the pain in the joints. The main source of stress for this individual was the very great difficulty suffered with and by members of her family, and there was very little that the patient or the practitioner could do to reduce her worry and anxiety in this area. She was advised to avoid arguments or situations of emotional stress as far as it was possible to do so. She was encouraged to take up her old pastimes of painting and gardening, since gentle pottering as these activities took her mind off her worries and allowed her to relax. In this case, nutrition was most important. Firstly, to support the deficiency of qi and shui, an adequate, balanced diet was organized. Secondly, iron supplement was given to support the deficient shui, and complete V vitamin complex was given to counteract the effects of tiredness and stress on the nervous system. Thirdly, since there was hypersensitivity of both gan and wei to fatty, sugary, or spicy food, and to strong tea or coffee and alcohol, these had to be greatly reduced. This patient was concerned about being overweight and periodically starved herself in an attempt to reduce it. Since this practice tended to aggravate the deficiency of both P and Wei, the patient was persuaded to avoid it. Although emotional crisis produced temporary attacks, the combination of treatment and patient education was greatly effective in this case, in all four areas, but mainly in arresting the deterioration rather than restoration to perfect health. Also, the effect of all but the most severe crisis could be ameliorated to some degree. Summary of case histories. In TCM, it can be seen from the 8 case histories above that 1. The entire process of diagnosis, treatment, and patient education is in terms of 8 principles, disease factors, substances, Jinluo and Zangfu. This is a framework on which all clinical practice is based. 2. In each of the 8 cases, even the simpler ones, there were at least 6 patterns of disharmony of Zangfu and Jinluo involved in each. This emphasizes the need for the practitioner to be thoroughly fluent with general theory, clinical theory, and clinical technique if there is to be any hope of accurate diagnosis of disentangling the various threads of apparently conflicting evidence and of weaving a clear pattern. 3. Besides the various patterns of disharmony involved in the major illness, there may be one or more subsidiary disharmonies, some of which may have a little connection to that main disorder. For example, in case history 6, there are 4 separate patterns of disharmony, 2 of which are mainly Jinluo patterns, and 2 of which are predominantly Zangfu patterns. Although all 4 are linked by the general condition of deficiency of qi, they arose as 4 separate areas of illness. This is very common in the West, where an individual patient may present with a whole range of chronic disorders.